Welcome to Friends with Fertility, the podcast where we dive deep into the world of fertility, reproductive health, and all the emotional journeys that are in between. I'm your host, Elizabeth King, a fertility expert dedicated to providing you with the knowledge, support, and inspiration you need on your path to parenthood. Whether you're just starting out, exploring your options, or looking for solidarity and advice, we are here for you. Let's embark on this journey together and turn uncertainty into empowerment and make friends with fertility. Let's get started. Hey everyone, welcome back to Friends with Fertility. Today we have Katie Beecher. Welcome, Katie.
Thank you so much for having me.
I'm going to tell you all her bio so you can get a little bit of information before we get started. She's a licensed professional counselor, renowned medical and spiritual intuitive with over 35 years of experience. She has been featured in major outlets including Goop, Poosh, Miranda Kerr's blog, Coast to Coast AM, Bloom TV, and more than 200 articles, podcasts, and summits. With a combined following over 55,000 across Instagram and Facebook, she is widely recognized for her unique and impactful work. She frequently supports women and couples navigating fertility challenges, miscarriage, grief, and related emotional and spiritual issues, helping them uncover the emotional, physical, and energetic root causes behind their struggles. Katie also specializes in guiding individuals to connect with their intuitive bodies and their spirit babies. Yay! Mm-hmm. Her own healing journey began at the age of 16 when she independently sought help for severe eating disorder, depression, and anxiety. Now recovered for over 3 decades and having healed both from Lyme disease and mold toxicity, Katie draws from deeply personal experiences. She teaches clients on how to listen to their messages, the messages their symptoms are sending them, and integrate intuitive wisdom in their healing. Her readings are uniquely structured. Before meeting with clients, she creates a 4-page report and intuitive soul painting using only a name and age. Her accuracy and insight have been verified by medical professionals, celebrities, and top media. She is an author of the international best-selling book, Heal From Within, a guidebook to intuitive wellness from St. Martin's Press, which she combines her personal experience and spiritual guidance with research-backed insights on root cause healing. I do not even know where to begin because every single step of the way, and I'm like, my people. You're speaking my language on all levels. I literally don't even know where to start. I have goosebumps. I'm so excited. So speaking of that, let's start with the 16-year-old healing journey, because I feel like so many people that I talk to now, we're dealing with fertility, obviously. But a lot of that comes from the people that are seeking fertility are very type A. So they're able to do all these things correctly and are not seeing a result, a lot of which stems from eating issues at a younger age and control. And they're not really putting 2 and 2 together there. Not necessarily that they're related. So I'm certainly not saying that by any means. I'm just saying it tends to be a situation for people who have eating disorders, that is their ability to control in a situation that is out of control in some sort. So take us back on your healing journey from you and how you had this kind of self-awareness to know that you needed to seek help in that.
I love how you put that all together, actually. I really do, because
I have a little background, so I'm not going to lie.
Right. Yeah, I kind of thought so. But yeah, we are interesting individuals and can accomplish wonderful things. And when we can't accomplish them, life is pretty frustrating. So there's a little bit of learning to kind of step back and trust and listen. And that's part of what I help to do. So that's kind of what I had to do when I was 16. I was throwing up 3 times a day and doing all sorts of things. I had a suicide plan because I just couldn't live like that anymore. Right. And all I can say is it was divine intervention, because I came from school one day and just decided I don't want to die, but I can't keep living this way. So I called our pediatrician, didn't tell anyone else. My parents knew it wouldn't be of any help. So, and told them what was going on. It was 1983. So no one was really talking about eating disorders then. And the response I got was, well, I'm sure you'll grow out of it. It'll be okay. It's good you called, but And I said, no, that's not what's going to happen. So he gave me the name of a Jungian psychologist, thank God, who, anybody who knows anything about Jung, it's really spiritual. And she was very open to me talking about the dead people that I sensed and talked to, and the mediumship and the sensing evil and negativity and intuition, and a lot of it I didn't really even know how to put into words
Right.
at the time, but I knew that in my dysfunctional family, I wasn't being true to myself. I couldn't. And that type of therapy was what I needed to help me love and accept myself and just get to know me in my, lovely type A neurodivergent way. Um, and so I ended up, working really hard and starting the recovery journey. Um,
Mhm.
and I went to school to become a licensed counselor and always worked really intuitively. So really listened to what I thought the clients needed to hear when I was working
Mhm.
with them. And eventually I started to accidentally channel their dead relatives. And
I love that accidentally.
it kind of,
That reminds me of the book, oh gosh, Many Lives, Many Masters,
yes,
right?
yes,
Where is it Brian Weiss? I think
yep.
Dr. Brian Weiss. That was kind of a huge book for me when I was
Yeah.
kind of starting out 25, 30 years ago of like, wow, this is amazing. It sounds just like what you're saying.
It's so true. And when I was young, I started to read all those books about near death experiences and things. And it was like, okay, somebody else is talking about this. So it's not just me. And there's more to this. And that really kind of opened my eyes to the possibilities. And then it sort of developed from there. I realized I couldn't push my intuitive abilities away. They were part of helping me heal, helping others heal. And
Hmm.
it progressed into me doing the medical intuition work. I see like, 6 or 8 clients a week. So just because of my brain and my energy, I can't do too much.
Sure.
But yeah, this is my thing. I work with some clients on a weekly or monthly basis and things. But so that's kind of how it all started.
Amazing. And again, we see this time and time again, myself included, about the experiences that we have in our past, in our childhood, that leads us to this path that we are living now and our mission, so to speak, to help other people. So thank you for taking the time to shed light on that, because you also mentioned in your bio about how you pull from your experiences. I also work from that way as well. I know traditional therapists are usually trained to not cross that boundary of talking about their own experience. I found when I was going through therapy in different times in my life that that's what was missing for me. I wanted to know, can you relate to this? Do you understand what I'm talking about? And so now it's really important for me to bridge that gap for my clients and patients, for them to understand that it may not be the exact same situation or story as yours, but there's a part of it that I can relate to. And I feel that that really helps them to open up and the healing to start to begin, because you find that one connection with people of like, oh, she has been through this. She does get that.
No, I love
Which le
and because they look at us like we're all perfect and have our crap together, and we're a work in progress, and I consider myself kind of a guinea pig for my clients,
Right.
some of the things that I've been through. So the more I learn, the more I can help them.
Absolutely. And I appreciate that the fact that more and more people are now being open to sharing their experiences, especially therapists that are going towards the fertility journey of saying that they've been through it, in some cases now, which I think is really helping that community. So let's talk about the medical intuitive and all of that, because I think for me, especially because I've been into this world for so many years now, it's a natural way to go. Like, you'll talk to your medical doctor and you'll talk to your medical intuitive to see what we can do to help to get to the bottom of it. And it's not that I have to take everything as like this is the Bible and what this intuitive is saying. No, but it might give me some insight of what I need to be doing, or doing some additional healing exercises from a spiritual perspective that can help open up the channels in my body of healing in other areas, so on the physical side. So especially when I was going through fertility with losses and stuff, I was clinging so tightly, Katie, to my all my psychic medium friends that were there to help me, to try to put my head around what was happening here. Why was this happening? If this pregnancy was so meant to be, why did I lose it again? What's going on? Like, is it? as much as I knew at a soul level it wasn't me, I was trying to make sense of something that I wasn't able to make sense. And again, that grasping and holding so tight onto trying to find the answers led me to letting go, ironically, of understanding this much bigger picture, right? It wasn't about me. It wasn't about me wanting to have the baby yesterday, or,
Mhm.
it's about this larger soul contract for all of us involved. And kind of surrendering to God, the universe, whatever it is that for me it was God, but that there's a bigger plan. And now, of course, that it's in my rearview mirror and I have my three little souls with me, I can make sense of that. But in it, it's really hard and traumatic to go through. So I know those were such the people that helped me were such rocks in that period of time. How do you help people that are coming to you in that really traumatic situation of just in desperation, really, of like,
Yeah,
what should I do? Where do I go from here? And do I even keep going on this journey? Right? Like
exactly.
some people are just so frustrated, but yet there's some glitter of hope that they're continuing like
I
to do
know
this.
you described that so well. And I so feel for people who are watching people around them get pregnant or seeing, parents who don't take care of their kids and they're these awesome parents and they're like, why? I'd be such a great,
Yeah.
like, oh my God. And so I am not the kind of person who's like, okay, well, maybe there's a reason and blah, 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 because there may be, but that's the last thing you freaking want to hear when you're,
Right. That's not helpful when we're in that.
right? Like, shut up. Okay. No one wants to hear
Yes.
that. So
Right.
what I do, and I feel pretty blessed to get to do this, is so I start out with a report and a painting, just knowing someone's name and age and blah, blah. Okay. So what comes up in that report, and then we talk about other things, while we meet too. But what comes up is physical, emotional, and spiritual things that are going on that people may need to adjust or heal or learn from or, make some sort of changes that will either help with their personal health, help with having a healthy pregnancy, a healthy baby, a less traumatic delivery, maybe less complications, better lives afterwards. So
Right.
those things are huge, and it often is physical, emotional, and spiritual, but people are kind of blown away sometimes by the things that they don't connect. So, for example, um, I pick up a lot of Ehlers-Danlos, which is a connective tissue disorder that can have some infertility complications. So a lot of people don't even know they have that. And so that,
Can you explain what that
yeah,
is
yeah.
and how people would potentially start to understand that they may have this?
Yes, absolutely. So um, connective tissue is basically collagen and elastin. It's all throughout the body, and it's a constant inflammation. So as we know, inflammation is not necessarily conducive to fertility, right? And so it's a genetic disorder. There are 13 different types. The most common one doesn't have genetic factors. The outward sign that most of the diagnosis comes from is a hypermobility of the body. Now, having said that, there's a zillion other symptoms. And it's very tricky because as we get older, we get less mobile. Maybe with pain, we get stiffer, we don't move. So as we get older, it can be harder to identify these things just from the physical markers that a lot of doctors use.
Right.
Also, because the symptoms are all throughout the body, it mimics a zillion other things. It's often labeled as fibromyalgia or other things that it's just these labels that people slap on things because they don't know what else is going on. So I have it, my daughter has it. That's partly where my guinea pigness comes in. And knowing more about that has helped me to help others. But some of the problems are just like pelvic issues and hormones and gut stuff and organs being in the wrong place, and just the list is endless.
Interesting.
People can,
Okay.
write to me for more information. It's on my Instagram. There's a ton of posts about it. So
Okay.
it's one kind of hidden thing that can be a physical contributor to fertility. And just last week, I met with someone. She was in her early mid 40s, had been trying, for a while. And our conversation, my guides ended up pointing out that she was having some relationship issues with her partner and also with her in-laws, and her mom, actually. And so she was having a lot of trouble setting boundaries and using her voice and being authentic. And so she really felt very oppressed, and like the sort of weird things that came out were, how do you feel about having a child and having them come into this relationship where you don't feel empowered, especially maybe a little girl? Or how do you feel about not being able to set boundaries with your own mom and having her maybe do some of the things she did to you, to your child? And there's
Hmm.
a lot of these kind of subtle things that aren't so subtle that are really, really important. And
Right.
so one of the things with her was realizing that she had been needing to make these changes for a long time. And that by doing so, it would not only impact her physical health, but also her emotional and spiritual health and her relationship with her partner. She
Hmm.
was concerned that her partner wasn't choosing her over his parents, So there was some internal conflict there. And
Right.
would he then choose his parents over a child? There's so many things that are,
Right.
possibilities, but being able to dissect everything going on in people's lives, even something like having Lyme, or a co-infection or something like that, and not
Hmm.
realizing you have it, and a lot of people are walking around with it, and that's something that can be transmitted in utero, right? So if I cannot diagnose, I don't do that, it's illegal, but I can bring up symptoms and I can link them with people I trust to do testing and treatment and things like that. So
Right.
if I pick up those symptoms and they verify them, and we're like, that could be a very distinct possibility, you want to heal that before you get pregnant, you know?
Right.
So it's just things like that. And even with EDS, your ligaments are very lax. And so it impacts your pregnancy. It impacts what you can do and not do during your pregnancy. It impacts maybe whether you might need a cesarean or not. There's so many things that,
Hmm.
people don't always know about or think about.
Which is interesting because I feel when people get educated and have an option, not to self diagnose, but to say to their doctor, hey, can you check this out? I read about this. I heard about this on a podcast. Can you just make sure and outrule it? Not to say that you have it, but at least if we're checking off the boxes for the physical, then we can continue to unwind the onion, so to speak, of the spiritual and emotional. That I see all the same situation that you're talking, Katie, about your client. I see that all the time with
Yeah,
relationships and everything. And then it ends up turning out in some cases that are like that they don't end up together
exactly.
because that's why the energy of bringing the baby was blocked, is because that was really protection from what could come in the future. So let's talk about spirit babies, because that's an area that I love, and I also get spirit baby downloads,
Nice.
which is so fun and trippy at the same time, because whilst your story saying that you recognize this at 16, I didn't recognize this until I started working with people who were expecting babies, and then it was
Nice.
like this crazy situation.
I love it. Right.
So how do you help your clients connect with their spirit babies and kind of again bridge the gap so that they can understand that this is really what the message is that they're being sent to via you to them?
Right. So I am a medium also. So I get messages from a lot of people at the same time. Um,
Hmm.
so when I connect with babies, other loved ones come through also, which is really cool.
Okay.
And then kind of something that was happening when I started to do this work that surprised me is I was also connecting to babies that may have been aborted or
Hmm.
miscarried or something like that.
Right.
And there was so much grief. And we tend to, as humans, push down grief, push down anxiety, push down things that don't feel good. And so
Right.
by just sometimes I get messages through hearing things in my head, or I will see a picture of something, or I will see a picture of a person or something they like to do, or just, a feeling in my body, but a lot of different ways it comes in. But sometimes it was just helping them resolve that grief. Not that you ever get over it, and I don't mean it that way, but just having it not sting so much, and
Right.
realizing that the baby that you lost in no matter what way, like, isn't mad at you. You're not a bad person. You didn't do anything wrong. You don't deserve to not have a baby, all those kind of things.
Right.
Um,
Right.
but it's neat because sometimes I will see people in layers or babies in layers. So I may see, just throwing this out, like a little girl at like in the forefront, and then maybe, a little girl or boy or whatever in the background. And sometimes that might be the child that they already have, or it might be a child that was lost, or it may be the first child that they're going to have, and then the second one is kind of in the background a little bit. So they come through in such cool ways and tell you all sorts of things. Like, they are a great source of information of things that the parents need to do. Them saying, "Hey, you really have to take a look at this first, and your stress level is impacting me, and
Right.
you trying to control every bit of this is not helping anybody." And have maybe even suggesting that and I like to teach people how to talk to their own spirit babies and their bodies and their intuition and everything, but setting up a dialogue with them so that they can
Yes.
start talking to their spirit babies and their uteruses and eggs and all kinds of things. And
Right.
so I like to help them find them as friends and supporters, and in an interest, and you've probably experienced this, in a way that helps them step back and not feel like they have to be in control of everything, and that they have a little fun guide to help them.
Partner.
Yeah,
Right.
partner, yeah.
100%. I say narrate your day to this spirit baby that's with you already. So they know, this is where we're going to live. This is the park we're going to go to. This is,
Yep.
get them integrated into your 3D world that we live in here, because they're around you, but they're not. It's sometimes hard for people to grasp the concept yet of what does that even mean. I think some people have heard the word guides or spirit guides or uh, lots of different things, but spirit babies specifically are a little bit different, I think, in the sense that when you see a medium about an uncle that's passed, there's a lot to pull from, a lot of
Mhm.
information of validation points that a medium or a psychic can pull from in your lifetime around that. For the babies, it's a little bit different. But to your point, I've had babies say, like, I don't want to grow up in that city.
Right.
You guys need to move away from that before you get pregnant. And I've had that happen a handful of times, which is such a big thing to tell somebody, but it's been true. Not to have people uproot their life, but that could be something. Is the energy that you're living in around you, is there something about that that might not be conducive to you, your family, or et cetera?
Or mold in your
And
house, for example.
right, right. Well, that's a huge thing for a lot of people. So I think just being open to those conversations and keeping them as a partner. For people that are skeptical to this whole world and or new, what do you say to them to open that curiosity, so to speak?
Well, I think one obstacle, you may have found this too, is if people accept the idea of spirit babies, and that we can talk to the other side and that we can get insight into these things, there's an element of being afraid of getting your hopes up and
Hmm.
having it crash down.
Right.
And wow, if I talk to this baby, what if it's all in my head? What if it's not real? What if or so many people, what if it doesn't happen soon enough?
Hmm.
you know
Hmm.
I want it to happen tomorrow. What if it's not going to happen for a year? Or um, I've even so I'll go back to what I was just going to say. But I think that most people have been trying the same thing or the same series of things over and over and over and over again. And I don't blame them. You're following, medical procedure or
Right.
whatever. So,
It's what society has taught us to do.
exactly. So I'm just sort of like,
Hmm.
you have nothing to lose.
Right.
And hey, guess what? Remember when we were talking and I told you all these things that you never told anybody? Maybe there's something here. Maybe
Mm,
you can trust this a little. Maybe there's,
right.
it's worth looking at. Um, and so just having the faith to trust your intuition in your body is also scary and weird.
Right.
But
And something that, again, we're not taught to lean into that
right,
so much, which
right.
is just so crazy. That should be the first thing we lean into in our lives.
Exactly. Yeah, just the concept of trusting your intuition is really scary and weird, and trusting your body, because when people are having trouble conceiving, or they have an illness, or they whatever, the tendency is to disconnect from your body because you feel like it's your enemy, or that it's not working with you, or that you can't trust it. I'm doing all these
Right.
things that are right. I'm making these eggs. I'm doing all this stuff. What's the problem? So you tend to disconnect, and asking people to come back into their bodies, and listening and trusting some of that, and listening to those signals can be really scary. And I get that. So I just try to talk about how that feels, and ways that you can deal with some of the stress, and like movement and stress relief and all kinds of things to get your mind off of your 24-hour hamster wheel of fertility, because that's all people think about. And I get it.
It is all people think about. And I've been one of those people, as well as when you're saying this idea of, if I'm narrating to this baby and talking to this baby and building this relationship with this baby and it doesn't work out, I'm going to be devastated. Well, I'm here to tell you, if it works out and doesn't work out, you're going to be devastated regardless. Like, it's this false sense of protection that we think that if I don't connect in any way to this pregnancy or possibility of pregnancy or whatever it is, that we're saving ourselves from the pain. And I'm here to tell you, because I've been through it more than once, it hurts just the same. And so we can either lean into it and embrace it, and still talk through it with our spirit guides, our spirit babies, all of those things, and ask for the help as well from those people, and whether it's loved ones or spirit guides, or all of the above, or have this false sense of I'm protecting myself, which we're truly not. It's still going to hurt. It's
No.
still going to sting. It's still going to suck. It's still going to all of those things. And yet you're then for even that further behind, because you're still blocking this huge amount of love that you have to give to this other soul that is waiting to be heard and listened to, and connected to in some way.
You
So
think
I
a
just
lot
want
of,
to add that.
no, I love that. And a lot of people that I talk to, whether it's fertility or not, we get intuitive signals all the time. And we often hear things that are scary, such as you need to set boundaries, or you need to get out of that relationship, or out of that job, or you need to make a change, or whatever. So sometimes when people are listening to their body and intuition regarding fertility, they get the message of, maybe you're supposed to take a break. Or what about if there's another soul out there that's already born, like through adoption? Or what if you need to do surrogacy? Or what if and those are really painful, scary things to hear. And I get that. But I have worked with people who I have heard, and I say it very delicately, but have you given any thought to the fact that you may have a soul out there that's already been born, that you're connected to, who maybe needs you and you need them? And it doesn't mean that you cannot have your own biological child, but, you know, what about that possibility? And for some people, it's a relief to hear that, because they've already been thinking it, maybe. And I've had a few people look into adoption and even like get through the process and go through it. And then because they were more relaxed and they let go a little bit and they were on a sort of a different journey ish, they also got pregnant,
Right.
which was
I
kind of
think people hear that all the time, right? About those sorts of situations happening. And I'll speak for myself again, when I was in it, as intuitive as I knew I was, like you said, that hamster wheel of 24/7 of thinking about it. I would say it blocked my intuition a lot. And I remember telling my husband and my friends, like, I don't have a gut feeling. I don't know what I'm supposed to do.
Mhm.
I need somebody to help me. And that's again where I feel like psychics, mediums, intuitives, whatever it is, helped me to give me the clarity or the validation of what I already knew in my own intuition to say, yes, try this route, see how that goes first, and then maybe go back to that. So I just want you to people to understand that people like Katie can help you to root back to your intuition, and in those times where you feel like, I don't know if I have any intuition anymore, I'm not getting a gut feeling of which way to go or which direction to go. And sometimes it's just that little nudge of hearing somebody else say it, and then you reflect back to yourself after and you're like, yeah, I did know that. Actually, I did have a feeling that I was supposed to go that direction. So don't feel bad if you're not
Right.
feeling like you have no intuition on your fertility journey. I was in your shoes and I remember saying it over and over again. So lean on those people around you, like Katie or whoever you can seek out that can help you hear what your intuition is trying to tell you.
And actually, on that note, there are medical experts out there, and just like any other thing, you part of connecting to that intuition will help you to know, is this the right practitioner to be working with? Is this person understanding my situation? Is this the right technique for me? How are these hormones doing? Is this the right, are they giving me the right advice? Are they so? The more tuned in you are, the more that you can work with whoever you are working with and have it be more
Right.
effective, because that practitioner may not be the right person for you. And that's okay too.
Right. It's an interview process, I say. You're paying them, so it's a matter of you feeling, is your energy aligned with this person in whatever way that looks like. They could be the best doctor in America or in the world for that matter, but if you don't feel aligned with them, that's energy is going to be blocked between you. And I've seen it myself firsthand where I've had patients go to doctors that are very well known, but they just don't vibe with them. They're like, I don't feel good about them. And that's totally fine. You can try somebody else. So I think just give yourself that free agent to know that you need to feel like this person is on your team and supports what it is that you're trying to go after and has the ability to help you get to where you want to be, which is hopefully to your path to parenthood in whatever way that may look like.
Definitely.
So, what advice do you have for our listeners if they are trying to get pregnant and looking to connect, and just some lessons of hope, so to speak, for them on this path?
Well, a lot of what I've learned on my journeys, I do feel like I did that so that I could pass it on or help others. And I was told when I was very, very young that through self love, self acceptance, and connection to intuition, you can heal from just about anything. So don't forget the spiritual piece of your journey and your healing. And it's not all just physical. So that's really important to remember, and take care of yourself in the process, because if you're not emotionally and physically healthy, you're not going to be as prepared, let's say, Um, in my book, there's some really cool techniques for connecting to intuition and your body and the other side and spirit babies. And a lot of it involves some written back and forth, some of it based in Jungian psychology, but it literally saved my life. Like, I cannot tell you, I wouldn't
Amazing.
be here. I would not be healed. I would not, so many things. So there's a lot of things that you can do. And if don't so sometimes the fertility journey will bring up really severe emotional problems within relationships. I'm sure you've seen that, and
Yes.
one partner really wants to continue and the other partner doesn't, or is worried about their partner or whatever. So the more that you can work with whoever is involved, and it may be multiple people, and maybe a surrogacy situation where there's three of you or something, I don't know.
Mhm.
But the more that you can work with other people and not feel like it's all on you, that you have to figure it all out yourself, that you have to, there are other people, and even get therapy if you need it. Talk to people like me, like you, but don't. a lot of us type A people we just take care of things ourselves and we're not going to ask for help. And, the fear is nobody can do it as well as we can. And, that kind of thing. So,
Right.
Cultivate your tribe and talk to other people who've been through this, but be careful not to make it your whole life. So, like Facebook and all those groups can be helpful to a point, but then you can also get addicted to that. And your whole life is research and thinking about that.
Right.
So that creates other physical and emotional issues like cortisol and inflammation. So use your.
Could not agree with you more on all of those points. It's such a unique journey to be on and be aware of things that you can't unsee or unread and all of that, because that affects your energy as well. So stay in that self-preservation mode of whatever that may look like for you and seek out the help, and you won't regret it. I've never seen anybody who said, oh, I wish I wouldn't have sought help for this because I thought I could do it alone and it turns out I did it. They all say, I wish I would have found you earlier. I wish I would have done this earlier.
True.
So give yourself that gift of finding somebody that you align with on this journey and get your path a boost, right, and get it here sooner than later.
And it's not your fault. You didn't do anything wrong. It's,
oh, 100%. Yeah. I mean, I will echo that again. It's nothing that you've done, and it's such a bigger picture than on us, regardless of whether you have been diagnosed with something or not. It's still not your fault. It's just a situation that's happening, and you'll get through it. You just finding the people to help you support that will get you through it faster and a little bit easier and more gently on your heart and soul as well. So thank you so much, Katie, for being here. I feel like I could talk to you forever about all of these things. And until we meet again.
My pleasure. Thank you so much for having me. And, my love and support and all great energy goes out to everybody listening and watching.
Thanks so much, Katie. Thank you for joining us on this episode of Friends with Fertility. We hope that you found the stories, insights, and tips as inspiring and informative as we did. Remember, you are not alone on this journey. Your Friends with Fertility are here for you. If you've enjoyed today's episode, please subscribe, rate, and leave a review on your favorite podcast platform. And don't forget to follow us on social media for updates and more fertility resources. Until next time, stay hopeful and keep believing in your journey, and know that we are sending you lots of love.